Hi, I'm Dr. Jesse Schulz, physical therapist from Aguanago, Wisconsin. Today I'm going to show you my hip flexor program in terms of treating hip flexors that are too tight, won't stretch out, or you feel like you just have to come back to them again and again and again because they're limiting some sort of core strength, sport performance, they're giving you back pain or hip pain or knee pain or something of the sort. So our plan is basically going to be to shut them down with trigger point releases and then stretch them to help the connective tissue health. Retrain the other muscles that are supposed to be kind of functioning that they shut down. And then followed by that, just making sure that you're walking in such a way that you use them a little bit less when you walk around from experiences that I've had to make sure you get the best out of this and you don't have to do it for a long period of time. So realize first, the hip flexors tend to tighten up. If you don't have a good healthy spine, you don't have good healthy muscles around your spine, or if you sit too much. So those are generally, I think, the underlying issues of this. But one way or the other, if you have tight hip flexors that are problematic for you and you've tried other things but it wasn't successful, I find that this usually works pretty well for most people. Now, the only equipment that you're going to need for this is going to be some sort of cane or stick or pole or dowel or something basically about 1 to 1.5 inches at the end, which is not going to be pointy and not going to be sharp. Basically something that you'll be able to push into the hip flexors with to help do a trigger point release to relax them down. So what you're going to do is basically use this on the two different muscles that compose the hip flexors. Number one, the psoas muscle, and number two, the iliacus muscle. The psoas muscle basically connects to the spine, the discs of the spine, the vertebrae, from pretty much the entire lumbar spine. So realize that one side might be tender more so than the other. One side might be not tender at all. Both sides might be equally horrible when you do this. If you have pain or tenderness in this area, if you have not had any sort of abdominal issues like a aortic aneurysm or some sort of other digestive issue, generally when you do this, if it's tender, it's just the psoas muscle and it's nothing to be concerned about. With the psoas treatment that I'm going to show you first, realize that the only thing that might be of concern in this area is the descending aortic arteries. With that said, the aortic artery comes down from kind of your chest area and then it splits or bifurcates into the right and left side, and pretty much it supplies all of the blood supply to your legs. Now, for some people I find it's a little bit to the right of center, other people it's a little bit to the left of center, and sometimes before it splits, it's right down the middle. So the big thing is, don't be alarmed about this, but just realize that if you're doing this to yourself and you feel a pulse with whatever object you're using, move it a little bit, get off of it. You're probably just bumping into the artery a little bit. Ultimately, we're only doing this for 30 seconds and there shouldn't be any significant chance of harm. But what you're going to do is you're going to find your belly button and you're going to go about 2 inches off to the side of it. And 2 inches off to the side, about 1 inch up and down from that point, any point along there that you find that's tender is going to be a potential target for this. Now, you cannot do this standing or sitting. It just does not work. You have to be lying down on your back, knees bent or straight, whatever works better for you. But what you're going to do is you're going to take that implement when you're lying down, you're going to put it 2 inches to the outside of your navel or your belly button. And again, you can start either at the bottom or at the top, 1 inch below or above that line that you just came across from your belly button from. You're going to angle the top part of your stick implement away from your belly button about 10 degrees, and then you'll use both hands to pull in. Now realize that this muscle is very deep and it's pretty much right on the front side of your spine, so you will need to use some pressure to do this. You're going to hold 30 seconds of pressure. After 30 seconds, you're going to relax the pressure and then move along the muscle up or down depending upon where you started. But do it about 2 to 3 times per side, and I strongly recommend about 2 to 3 times per day depending upon how irritated it is. And that part of this muscle should be more relaxed. Now, the iliacus muscle is much easier to find. If you put your hand flat on the front part of your hips, you should find this little bony point kind of on to the outside of the middle where your pelvis wraps around. It's called the anterior superior iliac spine. And right where that point is kind of where the pelvis hoops around. And your goal is to basically use your stick implement again to basically push into that muscle that lives on the inside portion of the pelvis. So what you're going to do is, again, lie down on your back, legs straight or bent, move about 2 inches in from that point. You're going to angle the cane or stick away from it about 45 degrees when you're lying down and push in. Now this muscle is going to be more superficial or closer to the skin than the other one, so you shouldn't have to push as hard. But one way or the other, on that 45-degree angle, pushing towards the inner border of the pelvis, you should find pretty good success with this. And usually treating it 2 to 3 times per side, 2 to 3 times per day, helps get this muscle under wraps a lot quicker. Now, after you do these trigger point releases, typically the muscle will be able to generate more force, it will be able to stretch out a little bit easier, and you should feel either less pain or more relaxed if you have a problem with your hip flexors if you did this properly. But now we have to stretch the muscle. Now, depending upon how strong your legs are and how strong your back is, the lunge I'm going to show you to stretch this is your depth might change from one person to another. Ideally, when you're doing this lunge, if you had good leg strength, you would go down to the point where your knee's just above the floor. Your spine is straight, your stomach's tight, your back is vertical. Now, if you don't have good enough leg strength and all you can do is this, that's okay. It's better than nothing. But the big key is you have to take at least a moderate-sized step as you do this, because in this position you should already start to feel a bit of a pull in the back legs front of the hip. Once you get into this position, you'll raise both arms up overhead, and what you're going to do is you're either going to bend to the side of the front leg or twist towards the side of the front leg. Again, when you raise your arms up and either bend or twist, you should feel even more of a stretch here in that leg. Your goal is to do a 20-second hold with the bend and a 20-second hold with the twist. Now, if you cannot do 20 seconds all at once, and you can only do a 5-second hold, then do 4 of them per position of your upper body. And make sure to do it on both sides. Now, after you've done that, now we've relaxed the muscle, we've elongated it, hopefully improved the tissue health, or at least started to improve the tissue health a little bit. But now what we have to do is we have to get the back and butt and stomach muscles working a little bit more to make sure that they can do the job that they're supposed to do, so the hip flexors don't just get retightened again. Now, the best way to get this done, I've found, is kind of an exaggerated backwards walk. Now, what we're going to do in a second is I'll take a medium-sized step backwards. You want to rock your weight to the heels, and you want to be vertical over that back leg. After you get into that position, and I have to clarify, after you get into that position, you're going to squeeze your back leg's buttock muscles. You're going to keep those muscles squeezed. Then, and only then, you'll raise your arms up overhead and take 1 or 2 deep breaths in and then out as you're keeping that hip muscle, that back leg's buttock tight. You will then lower your arms down and take a step back with the other leg. You must do it in that order. You step, you rock, you reach up overhead after you squeeze the buttock. If you don't do it in that order, it doesn't seem to work very well. A lot of people try to rush it. They just try to pop into the end position, squeeze their buttock after they got their arms up overhead. It doesn't work as well. So, what I typically tend to encourage is at least do this for about 2 to 3 minutes after you're done doing your stretching, after you're done doing your trigger point releases. However, because this is a neuromuscular control element, doing it for probably a total of about 5 minutes per day or more seems to be helpful. But if you're doing it any less than 3 minutes afterwards, you're probably not doing yourself very much good. So what this should look like, I'm going to take a medium-sized step back, rock to my front heel, and you should see right now that I'm stacked over my back leg. I'm squeezing my back leg's buttock as I raise my arms up overhead, and I'm staying tall with this. My arms go down. I take a step back with the other leg. I rock to my heel. I'm staying tall, vertical over my back leg. My back leg's buttock is squeezed tight. And I raise my arms up again to make myself tall. Don't arch backwards, and really try to reach with your whole body up towards the ceiling as you do this. You do want to travel with this. Don't just take a step, go through the motions, come back and do it with the other leg. Again, it doesn't work the same. If your balance isn't very good, I would highly encourage you to do this with just one arm versus two, or have something very much close to you that you can bump into with your hip or grab onto for safety. Now, with that said, if you're only going to have one arm going up overhead, the arm that goes up overhead should be the arm of the leg that's in the rear. If you do it with the other arm, you're not going to feel the same benefit. So think of it, whatever leg you step with, at minimum, that's the arm that goes up overhead after you squeeze your buttock. So now, we've shut down the muscle, we've stretched it, we reorganized all the things around it to help them pick up the slack, do their job again, so the hip flexors can stay relaxed. The last element of this now is to use it normally when you're moving around. So, what you have to do when you walk is your butt muscles should be activating a little bit every time you take a step. Now remember, both butt muscles don't work the same unless you're hopping with 2 feet all the time. So, when we walk, one leg goes on the ground. As it passes straight underneath you, your butt muscles should start kicking in about here. And they keep working as you kind of rock to your toe. So, if you stand and clench your butt muscles as hard as you can, we'll call that 100% effort. Now, the key is, when you're walking, we only probably need to do that with about 10% effort. So, as I'm walking, I'm going to take a step, rock so that my leg's underneath me, give a little 10% squeeze as I carry over to the other leg. As I'm over this leg, I start squeezing this leg's butt cheek and finish my squeeze right here. And again, it's just a 10% squeeze. Now, most people when they do this the first time, they're going to say this is horribly awkward and it's very hard to do. And they wouldn't move like this during the day, and I 100% agree. The real secret to walking like this is you have to walk either fast or kind of more your normal speed, as long as you can walk that way safely. So with that said, whatever your normal speed is, you have to make those muscles work for you at that speed. So if my normal speed is this, I should be focusing on doing those 10% of maximum effort butt squeezes as I'm walking in that speed. You will feel it's much more natural and it's much more effective when you do it that way. So, I hope this helps you with reorganizing and treating your hip flexors and helping out with whatever issue that they're causing for you. but I found great success with this plan. Take care. Thank you for watching.